Welcome everyone to our final SOCAC meeting of 2026. Someone could help me with the slides, that'd be great. Just an overview of our agenda today. We're going to review the fiscal report and the edits and also vote. We're going to review the strategic plan final draft and vote. We're going to have some membership updates, an end of the year celebration, and then some announcements and closing.
All right. Next up is roll call. Allison Stark and Sonia Little Deer Evans. Oh for 2 right off the bat. Okay.
Sorry, I'm
Jackie...
trying to do too many things. Allison is excused.
Oh, okay. No worries. Jackie Serrano and Sandra Santos.
Jackie's here.
I'm here.
Robin Henderson and Anderson Dubois.
I'm here.
I'm here.
Kyle Johnson and Adam Peterson.
Kyle, I'm here. Adam, I'm here.
Judge Marisa Gates and Jaced Nunez Pineda.
Jaceed's here.
Jaced, sorry, my friend. Kathy Mosley and Emily Cooper.
Kathy Mosley's here.
This is Emily. I'm here.
Dan Toma and Cindy Cecil.
This is Dan. I'm here.
Ebony Clark and Carissa Cousins. Zafir Michael Berry and Lacey Andreessen.
Here and Legally 62.
Oh, well, then if that's the game, here and Legally 31.
Ooh, Lacey.
Like both seem to feel real good about that. So like I like it. I like it.
Ebony is excused too. I'm sorry. That's the last one I'll miss. Promise.
Annette Magiconi and Dana.
Here.
Andrew Grover and David Ratu.
David's here.
Andrew's here.
Alicia Overstreet.
Alicia's here.
And Adam Rodakowski is here. And my music listening age was 22, which made me feel cool, even though I'm not. So next up, group agreements as always. Back one. Or I can do Gare and then we can jump back. There we go. Okay. Group agreements. Family and youth are welcome to participate at any time. If you're a member of the public, not a youth and family member, we've got public comment period and you can contribute in the chat. Of course, we've got Joylene Carter, Alicia Overstreet, or Annette Magicotomy. If you have a comment you want someone to say for you. Folks, do please try and be present and participate. I know it's the holiday season. We're getting close, but this is the last one, so let's hang in there for a couple hours. Practice respect, avoid interrupting, use the name and pronouns people introduce themselves with, avoid acronyms if we can, and then help each other out in the chat to write definitions or ask for clarification if we do use an acronym. Varied opposing ideas are welcome. We're challenging ideas, not folks. Honor those with quieter voices. Avoid individual problem solving for situations and crises. Our focus, as always, is improving the system of care. Let's not talk about it. Let's do it. Well, let's talk about it too, but let's also do some things, huh? Be mindful of the power dynamics in the room and propose solutions, not admire the problem. And as y'all know, we use the GARE tool to consider racial disproportionality in our decisions. That's the Government Alliance on Racial Equity tool. We ask 4 questions when we're making decisions on policy, program, or budget, and they are also in our consensus slides. So what are the racial equity impacts of this decision? Who will benefit from or be burdened by this decision? Are there strategies to mitigate unintended consequences? And is completion of the full racial equity worksheet warranted? And if we do need that full worksheet to be completed, let's ask early. Better to have some time for our wonderful crew to process that which takes a fair amount of person power and hours. So, and Cody is only half of a human for us, though he is a full human in his life. Cool. All right.
All right. Thank you. Next, we're going to have our fiscal report. You should have received a copy of the updated version Wednesday of last week. It's also attached to the calendar invite. So Anna's going to quickly walk us through the changes to the report that were done in response to the feedback provided on December 2nd. And then we'll take a vote on whether or not to approve and submit this report to the legislature and governor's office. Anna?
Thanks, y'all. Bear with me. My computer is going incredibly slowly. So I have two documents that are opening. You should have received these, as Annette said, on Wednesday, and an email called Updated Fiscal Report for SOCAC Member Review. And it is doing a virus scan. Oh my gosh, come on, computer. Okay. Enable editing. I'll move it over to where you can see it. Is it big enough?
Yes.
Okay. Okay, so first thing, it is required to have a little preamble that talks about why we're submitting the report. We discussed in the feedback that it might be helpful to say that this report doesn't indicate necessarily an endorsement or a criticism of the way the funds were spent, but really just description. So I added this section here. I apologize I didn't do it in track changes. I was in a hurry and I forgot, and then I didn't know how to go back and undo it. So this report is descriptive in nature. It provides information about funding and allocations and where possible, numbers of youth served in each program. The report does not provide a value judgment on how these funds are spent or if there may be better investment strategies to improve outcomes for the population served by this programs. We also talked about maybe doing this report differently. It is due every 2 years. So I put a note in my calendar for early 27 to maybe call a work group together to figure out how we would want to do this differently for the one that is due at the end of 2027. But for now, this is what we have. The next section that we talked about changing was Emily Cooper asked if we could add some information about our grants in there. We sort of discussed and decided maybe this isn't the right place. If we want to do a supplemental report, that's something we can maybe call forward at the beginning of next year. We did make some specific changes in request to the mobile response and stabilization. This is where the vast majority of the changes happened. So one question was, where are the mobile response teams showing up? So we added that 30 to 40 in local community settings, private residences, 20 to 30 to hospitals and emergency rooms, 10 to 15 in community settings. And then we talked about separating out, we added these two links, the 988 Behavioral Health Crisis System fact sheet and the MRSS 2024 data brief, which answered quite a few of the questions that folks had. Feel free to raise hands or just speak out as I'm talking, because this could get kind of boring. So your feedback. So then I did make a note here. This was one section. We had the nested dolls kind of request of like, what is mobile response? What is stabilization services? How are they connected to 988, right? So this is where that is kind of described. MRSS use has increased as access to and knowledge of both the 988 and MRSS systems have grown. In 2023, MRSS served a total of 3,449 individuals, 2,612 of those being youth and 837 being young adults. In 2024, those increased to 4,699 individuals, 3,627 youth, and 1,072 young adults. A note from OHA that data collection continues to improve, meaning these numbers could be an undercount. And 63% of those who receive a mobile response service in that, and when we're talking about mobile response here, that's that within the first 72 hours, take advantage of some sort of follow-up service, right? And that's what the stabilization service is. So this is the question around how many folks that received mobile response enrolled in stabilization services, or the MR and then the SS of the acronym, which are sort of two different things. So in 2023, 245 youth or young adults, or 7.1% of total mobile response recipients, enrolled in stabilization services. And in 2024, 398 youth or young adults, or 8.5% of total recipients that received mobile response, enrolled in stabilization. Are we comfortable with how that looks? Okay.
Anna, this is Emily. Yes, I think you've done a really nice job like incorporating our feedback and concerns. And I think this language coupled with the kind of disclaimers at the beginning, I think covers a lot of it.
Excellent. I'm really glad to hear that, Emily, because I felt like I didn't love that we weren't able to be responsive to your concern. So if you're feeling like this gets us part of the way there, that feels better to me.
I think it does. And I think I was just part of it is like what this report's supposed to do versus like what we might want it to do is a different question.
And let's have that conversation in January 2027 so that we can gather all that data. If we need to start it in April of 26, whatever. But
Yep.
let's have that conversation, because we can do this report very differently when we have the time to plan and submit requests to the agencies.
Sounds good.
We also talked a little bit in here. We added some things about the community mental health programs. They attest to providing mobile response and stabilization services, but some of them aren't really doing that up to fidelity, as we might say. So we mentioned some workforce related issues and some data submission and reporting requirements. Then we added a little bit more detail about the training that mobile response providers receive. No other changes there. And let's see, what did we look for? Easy is the next section that we had. Requests. So easy funding supports, and we made a little bit of changes here. Reports completed quickly within 2 weeks. So again, being more specific with multiple debrief sessions to ensure clear understanding. We again added a link to this interdisciplinary assessment team fact sheet that connects to the easy program on the OHA website. And then we added in a lot more specific data around 482 youth were screened for eligibility for the easy services. And then that's broken down to 175 in 23 and 307 in 24. Of those, 236 actually received the testing, and that was broken down 97 people in 2023 and 140 people in 2024. And again, these are youth, not all people, right? These are youth or young adults. We talked about specifically where referrals came from. We had a little bit of that in the last version of the report, but this adds a lot more detail, including emergency department social workers, therapists, primary care physicians, education settings, child welfare, and juvenile justice. And then indicating that approximately 40% of all referrals come directly from family members. When appropriate for referral, 97% of the EASY program evaluations are used for intellectual and developmental disability, which are used for intellectual and developmental disability eligibility, are approved for services. That was data point we did not have in the last version. And in 2025, EASY began partnering with the Office of Developmental Disability Services so that they could give they could coordinate data around how many youth are referred and then actually accepted into services. So we put a little bit of qualitative data in here that came from OHA. I think they really wanted to have some of the narrative. And then not much added here except for some detail around this Portland Metro now extends to Lincoln, Tillamook, and Clatsop. and capacity was added to Opal K for 16 hours a week to help with a developmental pediatrician to consult on youth with complex cases, and the fact that insurance is not billed. That was one question that came up, and so this hopefully answers the question, but if it doesn't, please tell me. At this time, both OHP and private insurance present significant barriers to achieving a fully expedited service. I'm sorry, that should all be one thing. Insurance is not billed for this service. Extensive work has explored billing strategies. The full amount is actually going to pay for the care. It is not, we're not billing that out to service providers yet. It's pretty complex service, and so figuring out what to code it under and how to code it has not happened yet. Um, uh, Anything else on that? Questions, comments, things you asked for and did not receive? Okay, and then on IIBHT, we asked for some information about whether CCOs have any incentive to build IIBHT when they receive a global budget. And some other questions around counties. Dr. Ritu talked about counties that struggle to get youth into IIBHT and sort of that like expected no, turning into like almost a bedside denial of just like it's not even worth a referral because it's not going to happen. So those were answers that the Medicaid department were necessary to answer, and they did not have the time to get back to us with answers on those questions. So no changes of any significance are made in this section here, but we can follow up with Medicaid. And then we did again link the 6-month ombuds report, which discusses a number of the same concerns that Dr. Ritu named in our last conversation about this. I did add here, because we weren't able to get that feedback back from Medicaid as of the writing of this report, the incentive for CCOs to increase access to IIBHT services is unclear. Since the funding for this work is part of the CCO global budget, specific incentives to ensure CCOs prioritize access to this complex and important service are unclear. Our request has been submitted to OHA's Medicaid team to provide more information on this topic, and SOCAC will continue to monitor incentives and improvements to accessibility for this. Should not say whatever that word would be. Maybe it should say service. Should say service. Questions or comments on that? And then ODHS actually asked to make a couple of changes when they reread this as we were going through it. Lacey, I don't know if you remember what they were. I don't, and they're not in my notes because I'm looking at the notes from our
I don't remember, but they weren't major, Anna.
The only thing on this section that what did come up in this meeting was to separate the funds. Where is it? It's up above. Thanks, Lacey. Oh, here. Something around not trouble. System of care agile funds, separating them from the Medicaid flexible funding benefit for concrete supports, right? That those two are actually two separate things. And that was a request that came in from Selby to make sure it's clear, like they are similar and not the same, which is why they're included on one line, but separated by a slash. And that's what I've got. Any questions or concerns, discussion, places you want me to navigate to within the document so we can see it in a public meeting as before we move to vote?
So I think this is really good and thorough, knowing some of the barriers and getting some of this information together. So that's great. And I was, I think, on vacation when we reviewed it last time. So this is, one of my first looks at it. But is there a place in here that I'm missing where it actually says, yeah, there we go. Okay, so I'm looking for the dollar amounts on the different things. So are they tagged to each one of them? That's just one thing.
Yeah, and they're not like they're not highlighted or anything, but at the bottom of each section it says funding and then whatever it is, right?
Yeah, I see. Okay, thank you.
Yeah.
Sure you like the easy questions. Yeah, it's already there.
Yes, exactly. Please ask me more questions where I can just highlight something in the document and show it to you. All right. Well, does anyone wish to block the submission of the fiscal report? Oh, very helpful little worker bee from DHS just sent me a private message. We changed behavioral rehabilitation services on like page 8 of the report to say rehabilitation services because that's what it's actually called. And we cleaned up a sentence that was unclear in the last sentence on the behavioral health treatment foster care, changing a sentence to say child welfare has worked with providers and system partners to develop a standardized level of care based on outcomes from the demonstration project. The sentence said the same thing before, but it was very confusingly written. So thanks, Lydia. That's what's changed in the DHS section. Back to my question. Anyone want to block? Okay. Does anyone wish to stand aside? Does anybody have reservations that they wish to express before ultimately agreeing with submitting this as written? Okay, then please raise your little Zoom hand if you can in order to vote agree for submission as written. And I know it's kind of annoying, but I do have to say these things out loud, so I'm going to say it all out loud. Adam Rodakowski votes yes. Anderson Dubois votes yes. Dubois votes yes. Zafir Michael Berry votes yes. Alicia Overstreet votes yes. Emily Cooper votes yes. Dan Toma votes yes. Robin Henderson votes yes. Kati Mosley votes yes. Jackie Serrano votes yes. Adam Peterson votes yes. Sonia Little Deer Evans votes yes. Annette Magicotami votes yes. David Ritu votes yes. Lacey Andreessen votes yes. Andrew Grover votes yes. Jacite Nunez Pineda votes yes. Kyle Johnson votes yes. And Sandra Santos votes yes. Thank you all very much. You may put your little virtual hands down. And I will get that submitted tomorrow morning.
All right. We're 6 minutes early for public comment. We can't really dive into the next topic either, but I will hold for anyone who is here for public and open it up for public comment. Just give it another minute or two here. Sounds good. I see in the chat there. Thanks, Alicia. Well, if Addie can't jump on early, we can just play some K-pop Demon Hunters. Spend a few minutes. Adam can lead us in song. I'm sure you know all the words by heart now, Adam, right? Jackie's smiling like she does too. Yeah. Uh-huh. Anybody else got a 5-year-old, 6-year-old rolling around out there? Knows all the words. Yeah. Zafir knows the words. Um, I gotta get those like Kids Bop records that they use the songs that from when we were kids, but then they clean them up and put them to a kid's beat, but it's like Nirvana, Nevermind. Zafir, go ahead.
Some crazy lore. I used to own when I was little. Let's see. I think I stopped collecting them when I was 10. So I had every single one up until like 20, 2014. They're awesome and I love them, and they suck and I love them.
Of the Kids Bop CDs?
I sure did. Every single one on CD. I would play them full blast on my DVD player, and I would open the door to my little neighborhood and just dance in front of my house.
There you go.
You were just so cool.
I know. What happened, man? Now I crochet and watch cartoons, which is mostly stuff that I was doing back then anyway. But like, it's lamer now because I'm not adorable. So like,
You're still adorable.
debatable.
You went from being a kid to your listening age of 62 pretty quickly, Zafir.
It probably still would have been 62 as a kid.
Yeah.
In my household, we either listened to like hard metal, so like Disturbed, gospel, or jazz. That is all I listened to growing up. So that's why I'm 62 now. Been a hard life.
I've got a lot of 90s country in the back corner of my brain somewhere, so anytime I hear an Alan Jackson song, I just bust out in song. So,
real.
Well, I'm
Yeah,
not
if you need to know the words to any of Shania Twain's canon, I've got you.
Well, I'm not seeing any public comment. I know we're a little bit early. Do we want to just take a quick break till 3:45 since Addie is not here? I can.
Anyone who would like to block a break, raise your hand or speak now. Sonia, you want to block a break?
If it means we get done earlier.
I see.
I could do the membership update now.
There you go.
Okay.
Shoot, let's do it.
Are we, Anna?
Oh,
Are we
yeah,
good with
great.
that?
Let's reorganize. That's okay. I'll click over. Great idea.
Okay. So we are very fortunate in that we were huge thank you to Alicia, Annette, and Jasid and Anna for forming our interview panel. We met a lot of really great people over the last couple weeks. For the membership interviews, we did all of the CCO representative interviews and then the child psychologist interviews. Anna said, I have permission to share the who we are going to recommend as a panel. For the CCO representative, we are going to be nominating. Oh man, hold on. Sorry, Courtney Esparza from Trillium Health Plans. They represent the Lane County area as well as the Portland metro area. So a lot of different parts of the state are represented. Courtney's an incredible person. I think she's here, but really excited. She's the behavioral health director for Trillium Health Plan or Trillium Community Health Plan. And then for our child psychologist nomination, we are going to be nominating Dr. Amy King. Many of you have probably met her at her Cards for Connections trainings throughout the state of Oregon, and really one of the foremost experts in early childhood, which I know is not necessarily part of our scope here, but really an important lens that she brings to this work. And I'm really excited to have Dr. Amy on board as a SOCAC member. So we are really excited to be recommending them. And then we also have done a number of family voice interviews where we're going to be really connecting with the people from those interviews this week, but feeling really good about some of the folks that have been representing Family Voice that we got to talk to. So still going to thank you, Courtney. Really glad to see you here. Thanks for being here. We're going to do formal introductions of you, I think, in the next meeting. Starting in January, we do need pediatrician and tribal representative applicants. So we are still actively recruiting for those. If folks have people we need to reach out to or organizations we need to reach out to for both pediatrician or tribal representatives, we would love names or orgs to reach out to. Please feel free to send them my way, and I can start to do that recruitment. We are also going to be recruiting starting in the new year we have new seats, 4 new seats for people with lived experience, and that is not including the 2 current seats. So there are 2 lived experience voices for family voice, and then 2 lived experience voices for youth voice that we're going to be looking to bring on the council. So we've got a number of new folks who are going to be a part of this work. But those recruitments aren't going to start until January, and we are going to be announcing those as we in this committee. Any questions on membership or what we've been up to as the kind of ad hoc membership committee? All right, that's what I got.
Thanks, Adam. Getting new members is sometimes a heavy lift, and appreciate the work.
Thanks, Andrew.
Yes, indeed. And other folks are giving you appreciation in the chat, Adam. So thank you for taking on that role. Appreciate that and the recruitment efforts that y'all have done. So well done. Right.
Since we have some time, is it okay if I add a little bit to that?
Do it.
Oh, it's got stuff to say. We definitely need support when we move into our lived experience outreach around inviting people to the table who look like the folks who are overrepresented in our system. So to say that less euphemistically, we got a lot of white folks that applied to sit on this council, and we have really tried to make this council look like the populations that we serve. So when we're talking about juvenile justice, and I don't mean that system is full of justice, but that is what it is called, or the child welfare system specifically, we see Black families, we see Black children, Native children, and Latino children overrepresented in those systems. So bringing in youth and families who understand what that feels like, how the systems don't always work in partnership with your culture, with your community. We need help inviting those people to the table, and then we need help making them welcome at this table, right? There could be reasons why we only saw white applicants this time around, and there may be things that we need to change in terms of how we do what we do. So those recommendations can go to me, Joylene, Adam, Annette. If you were like, hey, I know why you only got white applicants, it's because you do this thing. If you feel safe and comfortable to say that to us, we would be welcoming of that information. So please, let's think about how we get a representative council so that we can do representative work.
Thank you, Anna. Yes, good call in. Appreciate that. All right, anybody happen to trickle in that wanted to provide public comment in that period of time? All right, well, we did at least clip off one later item to get us out of here a little early at Sonia's request. And good request, Sonia. Nice job. I appreciate that. Trying to think if there's any other things. Anybody have any positive news they want to share in their work or life as we kind of have a couple of minutes? Well, maybe we should queue up the Spotify Wrapped, Anna. I know the youth council, they have music at their meetings, and we've got a couple minutes before Addie's gonna roll in.
You know,
Yeah.
this would be a perfect time for Tongo to see.
We're not doing Tongo in a full council, but I do have a good song
Why?
recommendation if y'all want to put a song on.
Man.
What's that?
It would be. Let me pull it up so I get the name right.
Is it gonna be
Uh,
Anush?
no, it's not going to be him either.
Oh, come on.
Uh, Late Nights and Heartbreak by Hannah Williams and the Affirmations.
I like the band name. The Affirmations. Hannah Williams and the Affirmations, huh?
Can you hear it?
Somewhat.
Why do I find it my speaker
To love you.
I can hear the vocalizing. I can't hear any of the instrumental, and it
When
cuts
I
in and out.
know in my
Yeah. So
that I
it
want.
doesn't look like it's working, Anna.
Mhm. All right. Well, Christy could maybe kick us off. Is she here?
I am.
Do you think you could start us out on our finalist version of the strategic plan?
I think I could. Yeah,
Do you want me to pull up one or other of those documents so
That
that
would-
they're on the screen?
that would be great.
Which one do you prefer, ma'am?
Start with the plan.
Okay.
Both the plan and the appendices are also attached to the calendar appointment. They're also online. And yeah, Addie would do way better justice here, but we did it, folks. We finally have a strategic plan. This feels like a big day, and there's lots to celebrate. So, yeah, lots of celebration. Uh, Believe me, I am so excited to be done with this thing. Um, so yeah, I hope that you have all had a chance to look through this and give it a one last go through. Not a lot has changed since the last version you saw a couple weeks ago. We have a letter that will have. Do you want to just scroll through it, Anna? I don't know. Is that going to be make people dizzy? Um, but we have a letter and signatures from directors of OHA, Oregon Youth Authority, DHS Department of Ed. Those signatures will be included in the final designed version.
They're not here, but they will be on the final version.
They will be there. Yep. That's very exciting. Letter from co-chairs, Adam and Annette.
With gratitude and determination, which I love.
Brief table of contents. So some of you might be wondering why we have two documents. We have the plan and then we have the appendices. We intend to publish these as separate documents, really so we don't scare people when they open this. Best practice tells us that, if people see a document is, too long, they're probably not going to read very much of it. This plan is really the most important document. It's only 46 pages with the inclusion of sources. And then we have the appendices, which provide a lot of, helpful information and we'll communicate about those documents together, but are going to keep them separate to keep the page length reasonable on the plan. Executive summary, right into, brief introduction, a little bit of our process, and then the framework, our indicators.
Which were worked and reworked and worked again in the data committee. If you're like, why are you choosing that? Please refer to the literal year of work done in the data committee.
And then the goals and strategies that you've seen multiple times.
Goal 4. We move down to the implementation. Shall I just keep going, Christy?
Yeah, I think so. I mean, if folks want to stop and chat about anything, just shout it out. Okay, so then we get into the actual plan, a little bit about our grounding philosophy, about our governance structure, both the council and local systems of care. Description of priority populations and how we came to agreement on these groups. A little bit about the purpose of the plan, referencing back to our statute.
Quite a bit of white space, so it seems longer than it is.
Then we have a few pages about our process, kind of the work that we undertook this past year to arrive at this plan, the variety of folks that we engaged, how we engaged.
You're all very familiar with what the synthesis process looked like
Yep.
and the verify process, because
That was
you
really
were all
about
here for it.
the retreat. And then there's a little bit of new content here within Verify where we added in a summary of the public feedback. Um, yeah, over 200 people provided feedback on the draft plan. They voiced strong support for the overall direction and goals of the plan. Youth and family members validated that their ideas and suggestions have been incorporated. Additional information about feedback received can be reviewed in Appendix J. And that feedback is basically the table that we all looked at together at the last meeting. Limitations, those are the same as last time. The framework, you've seen all of this many, many times.
Is there a reason why we do this twice in here?
It's the executive summary. That's why it feels redundant.
Got it. Okay.
Yeah. A little bit of detail about our strategic indicators and referencing to Appendix G, where we talk about the data sources, disaggregated data, kind of trying to address the variety of questions we've received about the indicators.
And the baseline, which I think is useful. I don't know that we've talked about that as much here, Christy, as we did in the data committee, that we are already starting with like, here's where we're starting, and then we're going to measure change from there. So, and also the year the baseline was set. So it's not all consistent. Yeah, it's a lot. Okay.
And then we get into the goals and the strategies. So this is all the same. You'll notice there decreased transportation barriers. If you scroll back up, yeah, decreased transportation barriers to care in rural parts of the state. That was the decision you all made at the last meeting in response to the feedback that we received. And process measures for goal 1. Equity impacts for goal 1. Goal 2. Goals and strategies. And process measures. Equity
The reason
impact.
why these don't have anything on them is because we need to actually do the initial data gathering to set the baseline, and we haven't done that yet. Then racial equity, quick analysis on this goal.
Goal 3, strategies. Measures.
Oh,
Equity impacts. Hey, Addie. We're just scrolling through. We got started. You haven't missed anything. Thanks for being flexible with us.
And then
And
the
finally,
goal for.
go for it.
There is a question in the chat from
Oh, great.
Anderson.
Do we know when the data capture for the baseline will begin? Do you mean for the process measures that I just said we haven't done that data gathering yet?
Yes.
Yeah, Christy?
Yeah, we hope to gather that this year, or I'm sorry, in 2026. So that's that infrastructure survey is a requirement of the grants that we're now executing. So we'll be reaching out to our local system of care partners probably, later next spring about that survey and getting it out. I don't know.
Next spring being spring of 26?
Correct. Yeah. So I'm hoping, we need to kind of work with them to see what timing makes sense. But I'm hoping that we'll have that data by the summer.
And then we put it as a condition of our grants just for transparency purposes, because it is work that we're asking them to do, and we wanted to at least provide some connected funding for it. They are as resource starved as everyone else is right now in the state, and so recognizing that if we're asking them to do work, we should provide them some resources in order to do that work. Addie, is there more you would say, or do you want us to just finish this and then you can? Okay, great. So racial equity, quick analysis on goal 4.
And then a little bit about implementation. So here's where we link to that smart sheet that you have seen, we've shared. That is really the living document. That's what's going to live online. It will be updated frequently. That is where you are all named as leads for various actions. Again, we'll be in touch with you all during our strategic pause in January and February about what that means and what that looks like. But that's really where all the details are. So if you have not yet had a chance to really sit down with that document, I really encourage you to do so.
And if your first glance at that document causes you anxiety, please reach out to us immediately, because it is not intended to make it feel like you have all this work to do and you are somehow responsible for this massive systems change. You are a partner and a cheerleader, and we'll talk to you about how we hope to enlist you in that work. But I think the folks who have gotten anxious and then reached out have been like, oh, I feel so much better. I'm really glad we talked this through. So if that is your reaction to reading it, just reach out. We're happy to have that conversation. Christy, do you want to say anything about the parking lot or youth and family priorities?
Youth and family priorities. So those are the 18 steps that were identified by Youth Council and Family Advisory Council. Those action steps have been prioritized in the implementation plan. They're also included in like a separate table here in a couple of pages, just so we don't lose sight of those. The parking lot, remember all like the bajillions of sticky notes that you manifested at the retreat? We collected all of those ideas. Those are included in the appendix. Elements of a transformed system. Those are also some of the themes that came out of the retreat and through our community engagement. Those are all listed. Those really speak to the work that we're going to try to get to within Goal 4. So those are all noted in the appendix, as well as a nice visual that we use primarily with our local system of care partners during engagement. And then a little bit word about progress reporting. Here's those youth and family priorities.
And then the Oregon Youth Addiction Alliance, are those also called out, all of them here, or are those just separately called out in the implementation plan? I mentioned that because I see this here, it says shared. So was that family
yep.
and Oregon Youth Addiction Alliance, like all prioritize that? Is that what that is, Christine?
Can you scroll up?
Sure.
Yeah, that's right. So where it says shared, that's where both youth and family said, yeah, this is a thing to work on.
Got it. So there are priorities set by youth and family in each of our different goals, and in some, and not in necessarily every single strategy space, but in each of our goals. And then the people who did the plain language edit went through and added references. So thanks to them.
So that's the end of the plan. Um, I don't know if we want to go through the appendix too before
I
we
got this.
take a pause. Oh, Addie is here.
So
Thank
I
goodness.
think I'm sorry, I came on right on time and you guys are right in the middle, so I didn't want to step on any toes. I'm hoping everyone is almost asleep after that, not because it's boring, but because you're so familiar with it by now that there was nothing that surprised you, um, and nothing that made you think, wait, what? We did that? Because you've all been a part of it and you've had this for a couple months now, although the plain language review is different. Is that, I'm getting some smiles and some chuckles and some 100s. So that's exactly what I'm hoping to hear. We had one piece of feedback that we individually addressed with that individual over the course of the last 2 weeks. I know I really asked people that if they were going to have feedback today, that they get to me ahead of time so that we could sort of walk through any concerns ahead of time. But I will say, is there anything that people absolutely can't live with in the plan? I'm really hoping there were no surprises at this point since you've seen it, but if there's a need for a conversation, let's have it. Taking a strategic pause, I'm counting to 12 in my head. As you all noticed with our time together, the strategic pause is one of my big areas of growth.
Mine too. Jackie has some tips.
No big surprises, liked the references, loved what's coming in the chat. So team, I think the time has come. I feel like we should all, I'm doing a drum roll over here in my head. This is the moment where we are going to ratify this as a group. And because you all work on a consensus model, I think that probably the best way to ask the question is if there is anyone who objects, if we are not at a point of consensus after the delightfully exciting year you've gotten to spend with me. If you do object, now is the time to object. Otherwise, we will assume there is consensus on this and we can move it forward, both to present to the legislature, but more importantly, to become the plan. And the only thing I'll gently remind, of course, is that the implementation plan, that Excel sheet we worked on the last time we were in person, that's going to be ever evolving. So it's okay if there's a couple things on there you want to tweak. We've got time for that. That's an iterative process. It's the big document that we just walked through.
Well, we've got a
And
whole slide.
if I'm missing something in the chat, people please let me know. As we know, I'm not great at monitoring both.
Yeah, Addie,
All right.
we do have a process though, friend.
Oh,
so,
dang it. All right,
yeah.
Adam, I'll hand it off to you then. You run that process and I will be a willing
I
participant
appreciate
and
the
I'll learn.
enthusiasm. I wish that we could do it just like that, but we have an agreed upon process. So, all right. Does anyone block this thing? You're going to break my heart during the holidays, but I will accept it if you want to block it.
I won't, but that's not relevant.
Thank you, Jasim. Does anyone wish to stand aside? Does anyone wish to agree with reservations? Oh, Addie, we might be getting actual true consensus. You are a pro. Oh my goodness. I cannot believe it. I know. I'm honestly in shock, guys. Nobody has reservations. Everybody has reservations about everything around this joint.
Adam, don't
Careful what you
beg
ask for,
trouble.
Adam.
All right,
Careful what
okay.
you ask for.
This is a holiday miracle. Okay, if you agree, please raise your virtual hand that you are in agreement with this strategic plan. Whew, I'm gonna go buy a lottery ticket.
Oh my gosh, this is so cheesy, but I might cry. I'm a
Andrew
little
Grover
embarrassed and
votes yes.
definitely verklempt.
I'm sorry. I do have to read these out loud when we take an official vote, Addie, so you can cry while I read names. Andrew Grover votes yes. Zafir Michael Berry votes yes. Sonia Little Deer Evans votes yes. Dan Toma votes yes. Jesse Nunez Pineda votes yes. Alicia Overstreet votes yes. Lacey Andreessen votes yes. Robin Henderson votes yes. Emily Cooper votes yes. David Ritu votes yes. Ooh, people's hands have gone down. Jackie Serrano votes yes. Kati Mosley votes yes. Kyle Johnson votes yes. Annette Magicotami votes yes. Adam Rodakowski votes yes. Adam Peterson votes yes. And Sandra Santos votes yes. Woohoo! Also, I believe we can't count it, but Anderson Dubois had to leave and he said all looks good. So we have his support, if not his yes vote. Well done, crew. Well done, Addie. Well done, Elliot. I know you were also critical in making that happen. This is like a really big deal, you guys.
And well done, all of you. You guys did all the hard work. We just facilitated.
I think we might have had more disagreement on if I count as half or a whole person.
Indeed, friend. Indeed. I think we may. Well, wow, that is fantastic. What else you got? You have any like profound words for us, Addie?
I don't. I'm a little at a loss for words. I will say, I will be jumping back on with your core team in January for us to do a debrief just on lessons learned, what we really loved, what we might want to do differently next time. So if you're not on the core team, but you have ideas that you want captured in the like, please definitely do this again, or whoa, whatever you do, don't do it like that again. Feel free to email those to Christy and I so we can bring them up in that meeting. But just a huge congratulations to all of you. And I think last time it came up, I'll just reiterate that the sort of the hard work starts now because it's the implementation. But after what we've gotten through this year, I believe you guys got this. I think we can do this. I'm really proud of all of you. And it's been such an honor to be a part of this team. I have learned a lot from this project and from each of you. And I just huge thank you to you for trusting me and letting me be a part of this process and getting to know all of you and spend so much quality time with each of you. So thank you.
Well, thank you, Addie, from all of us. Yes, thank you so much, and thank you, Elliot, as well. You two have been fantastic. So very grateful to the work from all of you. Lacey, you can't leave. You're gonna miss the end of year celebration, which is up next. So I'm turning it over to our wonderful staff team who have some slides to kind of recap the year, honor the members who are reaching their end of their terms, and just kind of prep us for walking out the door to the holiday season. Who's starting from the System of Care crew?
So if Corinna was here, we would actually have these songs available to you, but because I am not the tech whiz that she is, what we have is some songs that people nominated to be our 2025 theme songs. Those of you whose Spotify age is 65 or near there will recognize I Won't Back Down by Tom Petty. I think that's a pretty fitting song for us and all of the advocacy that we have done with, to, for, and by one another as we have walked through this year together. Bill Withers, one of my personal favorites, Lovely Day. Green Onions by Booker T and the MGs. And then I don't know if, let me see if I can copy this link.
And I've got it pulled up.
You know Christy's got us on this.
This song, y'all, I've been wanting to play the song for like so long. I don't know if we want to play it now, or maybe we can just like use it as like a, goodbye song.
We play ourselves out with the 2025 strategic planning song.
Yeah.
Okay. So you can just wait with bated breath for Christy's 2025 strategic planning song. That will be the last thing we do in this space. We had some photos shared. This here was our youth council telling the provider world what trauma-informed care actually looks like and feels like to young people and what it doesn't actually look like and feel like to young people. It was one of my favorite things we did this whole year. I didn't even submit that picture. I don't know who did, but it was transformational for some folks who were in that audience. They continue to bring it up to me that they think very differently about how they do their work because of what that panel told them. This is Olivia Moody. I don't know who submitted that. And then here we are, our backs, crossing the bridge on our nature walk during the strategic planning retreat in July this year. Bright spots that people submitted for 2025. Some Things of Fear Setter did. One of my favorites from there. Finally getting the strategic plan together. I remember starting this process years back and getting frustrated with someone from out of town. It just proved to me that we know what we need and have the experts here. For me, that really echoes of what Dr. Dempsey said a few years ago, that all the wisdom we need is in this room. Being in community with the full team at the 2025 retreat, laughing and learning together. Um, this one makes me feel good. I see improvements across Oregon's child serving agencies in terms of how they work with and engage with people with lived and living experience. I know it's not perfect and probably never will be, but I'm moved by the recognition that lived experience is critical to system improvements that seem to be dawning across systems. I feel like SOCAC members can take a lot of credit for that. Pat yourselves on the damn backs, folks. That is a huge accomplishment. And I enjoyed the in-person meetings. It was great to see people and be reminded of all the different humans trying to make Oregon a better place for youth. Is there any bright spots as you heard these that you want to speak out into this room yourself? Maybe you didn't have a chance to fill out the survey, or maybe something just sparked for you. It's more fun when other people talk and not just me. And we learned bright spots from our family advisory committee. Credit where credit is due. So this is something that Alicia and Annette do at the beginning of their the SOC-FAC meetings. So thank you for demonstrating to us how to open a space with gratitude. Emily Cooper.
I think we saw this year a real corner turn in terms of youth and family engagement, the numbers, the voices, the space. I think Joylene and Alicia and Annette, you guys have done amazing in like not just holding the space, but creating it. And then seeing Jased and Zafir and Hannah and everybody else come into this space. In the disability rights community, we have that expression, nothing about us without us. And I really feel like we talked about it for a long time. We planned around it for a long time. And this year it felt like we really did it. And I know there's more work to be done. And I'm just really excited about it because we're not just another advisory committee. Like the people that are on this committee, like have lived experience in lots of ways, even if their role isn't necessarily lived experience. And I think that's legit and really cool.
I love that, Emily. When you say lived experience, even if their role isn't lived experience, I look at people like Sonia, with that newspaper article that went out describing her experience. And I know Annette's jaw is a lived experience voice, but also all of the lived experiences that she pulls into our room from her paid employment, on behalf of the council. Zafir keeps hearing his name. We're talking about you. Anything else anyone wants to say on bright spots? We're just taking a minute to reflect back on what the value was. So I'm sorry, I pressed the button too soon. If there are other things to say, feel free.
I already had my teary-eyed farewell with youth council, but I will kind of echo some of the similar things I said there. That I feel the improvements we've made this year, just in our overall communication structures and ability to actually get things done, has been uh, nothing short of miraculous. And I am proud of the work we have done this year. And here's hoping we continue to ramp up going forward.
With gratitude and determination, folks. All right, so
Anna, I just want to add to that, and I just want to give you guys a shout out, Anna, Christy, Joylene, Cody, everybody who's on the council, working on the council, I should say. But the communication, just the support and working with y'all in this and outside of this for other pieces, is just, I think, joyful. You guys bring a lot of good, positive energy, even in the really hard moments. So I appreciate your facilitation and all that you do to move this work along. So I don't see this represented, but want to make sure it's out there.
thank you. Staff will always take your kind words, folks.
And I do want to add, I put up my grandmother's picture there because she was a midwife doing community health work way back when, helping her community. And I added that because she not only did that for her community, but she consulted with doctors at Bishop College to learn how to do it better. So that's what I captured from, that's what I pull from the council. We're pulling from each other on how to do things better. No one person knows all the answers. And each one of us in various capacities are the experts in the work that we do. So I included that because of her collaboration with systems that weren't always so inclusive. So and that's what I've learned from everybody to collaborate and listen and work together. And I think that's what I took from the council. I'm sorry, but I worked with Jackie today on getting a client some help, and that's what it's all about, that collaboration. If I had not met her, this child would not be getting the support and help that they need. So Jackie, thank you for giving me that information. So thank you all. I love you guys. So thank you.
Thank you, Annette. Now we're going to put Robin on the spot. Woo! Robin Henderson is one of our founding members who is leaving the council because she is termed out. She's not leaving because she wants to, folks. So folks had some things to say about Robin, and I will read the things off the slide. And then if other folks have nice things to say about Robin, you are invited to unmute and say those things out loud. So Robin is a founding member of the council who helped write Senate Bill 1, which created us. A true leader in policy and program development, you will be so missed. Thank you for your willingness to dig in, speak up, and even fight for Oregon's kids with the most complex healthcare needs. Robin, your fearless leadership has inspired so many. Thank you for everything you have done in your role with SOCAC to improve outcomes for Oregon's children, youth, and families. Robin, thank you for saying the hard things and sharing your system knowledge with us. And thank you for providing such aspirational leadership and knowledge. The state is a better place because of your efforts, and your 6 years of service have been truly transformational for this council.
Well, thank you for all of the kind words. It has been my privilege to serve with all of you. The council looks different than what it was that I think we all envisioned when we got together for so many weeks, or so many months, an entire year it took us to come up with this whole idea of facilitation. And that's okay, because it's become what it is needed to become, and it's going to become more with all of your leadership going forward. Please care for it. Please care for each other. Please speak up. I may not be in the room to say the things that people don't want to say, but make sure you say them. Because if we don't speak the hard truths to each other, we're never going to be able to change this system. And yes, Adam, I will come to your house. I will hunt you down. You will always take my calls. And if any of you ever need me, I am just a phone call away. You all have my phone number. I'm not going anywhere. I'm still going to be in Oregon. I'm still going to be around. I'm still going to be a pain. But thank you for all the work that you all are going to continue to do. It has been a pleasure getting to know all of the wonderful people that I've gotten to know through this process, and I look forward to working with you for years to come. Thank you.
Cindy is not here today, I don't believe. But Cindy Cecil was our tribal behavioral health representative and will not be returning because she's taken on another role within Yellowhawk Clinic and is not really able to, as you can see, make the time to get here because there's a lot of real work needing to be done in front of her on the day-to-day. So we are working with the behavioral health team, the tribal liaisons of the behavioral health team to replace her. Lots of gratitude for her advocacy on behalf of Indigenous communities and getting to know her better at the retreat. If there's other things folks want to say to Robin, I'm sorry, I guess I moved on. maybe too quickly. There's love happening for you in the chat, Miss Henderson. Dr. Cousins, I don't think she's here either. She is also departing. Am I missing her? I don't think I see her here. She was with us for 3 years. Her commitment to and leadership on behalf of children who have survived abuse is deeply appreciated, and we wish her all the best as she moves on to her next opportunity. We have benefited from the value she brought while in the role, and we deeply appreciate the work she does at her local, in her local system of care, her local child advocacy center, and across the state. Anything else folks want to add about Dr. Cousins? We continue to recruit a pediatrician to sit in her empty seat. So if you have friends who are pediatricians who have time on their hands, invite them to join us. And Annette, I'm gonna have to turn my camera off for this one. This will be the third public crying that I have done on behalf of Annette leaving the council. And we have a message from Annette as well, but Annette has been with us for 5 years. She unfortunately got a little shafted, I think, in the appointments bucket when she got her 1 year first appointment and then a 4 year renewal. So we are losing our lived experience co-chair. We are learning the grounding and founding mother, one of the anchors of the council that keeps us steady and focused on our equity priorities. Remembering always that there are voices who are silenced or unheard, even as we continue to reach out to try to hear them. Her ability to lead us through complexity, to listen to difficult conversations, to the need underlying whatever that conflict was, and to continue to forgive and show up, taught us all, I think. She demonstrated what true leadership and partnership looks like, even when it's real hard. May we all live up to the example that Annette set for us in doing this hard work with heart and with soul. I'm not going to cry. Annette, thank you for your clear and intentional leadership in this space. And this might be coming from Joylene. Nettie, we have all learned so much from you throughout your time on this council. Thank you for your fearless leadership and steadfast commitment to Oregon's children, youth, and families. You've kept this work focused on communities that need access to services most, and you have always spoken up for those who are too often forgotten or neglected. You have left a legacy on this council that will always be remembered. And Annette herself put a message in the slide. Would you like to read it or would you like me to? Okay. A message from Annette. I respect all of, I forgot to pin her so that we can all watch her be sad about this. Here you go. Spotlight for, oh, you don't want it. Okay, I won't. A message from Annette. I respect all of you and have learned so much and value as you have helped me grow as an advocate. I know so much more than I knew when I came into this work on the council. You don't know how much you all have mentored me informally. Thank you, Anna and Adam, for your advocacy on behalf of families. I truly value your leadership and guidance. Anyone else have goodbyes they want to say to Annette out loud?
Oh gosh, I think I actually have one. So coming into this work as a little baby, having not done it very often, I remember meeting Annette for the first time and being astonished. Because you guys might not know this, I don't have the greatest relationship with my family. But she looks a lot like my big mama. And so for me, part of meeting Annette, getting to know her, and oh, my heart's beating, and like getting more intertwined in this work and going to the conference where they're and all of that has really helped heal something deep within me. And I really appreciate you for that.
I have been occupying these spaces for a long time. And I don't mean it lightly when I say Annette is like a one in a generation advocate. I don't think I've seen anyone who holds not only just her passion, but also just the pure strength behind how she carries herself, and she will sorely be missed. But I'm sure our paths will cross again as this work is all reaching. So I wish you the best, and I'm looking forward to the next time we work together.
Thank you. Thank you, everyone. Thank you, Joylene and Christy and Anna, Adam, Cody. Thank you. Everybody's just been great. I've really enjoyed my time with the council. So thank you so much. And our paths will cross.
I don't believe Dana Hiddle is with us, but she is also leaving as she is no longer the director of the Intellectual and Developmental Disabilities Division at Oregon Department of Human Services. So we will be filling the seat with whoever is hired for that position whenever that happens. And so her seat may sit empty for a little bit. No, she's moved to the director's office, and we really need the ODDS director to sit in this seat. So Dana was appreciated, and now she is gone. She had 1 year of service with us. And I don't know. Oh, holiday share. So what do we do to celebrate the holidays? Let's just pause. We're gonna go back. We're gonna go back. And we're gonna sit here for a second, and we're just gonna take a pause and let some of the positive things that we all said and the gratitudes just sort of sink in for a second. And then we'll talk about our holidays. All right. Crying on your tablet. Oh, honey, I'm sorry, Zafir. Okay, so our holiday share. If we were meeting in person, Christy would bring lefse for everybody. Christy, I don't even know what that is. Do you want to tell us?
It's like a Norwegian flatbread made out of potatoes, traditionally served with like butter and sugar and cinnamon. It's tasty.
Do you make like you mash and smush the potatoes down, or do you just buy like potato
You have to rice the potatoes. So you boil the potatoes, rice the potatoes, which is different than mashing. Add flour, some cream. It's kind of laborious, and you got to let it chill. You got to be at the right temperature. You got to have special like pastry thing, special. Anyways, if you want to learn, come on over. I would love to teach you.
Annette might want to learn. She learned how to make croissants when she went to France a few years ago, and I think she still owes me one.
I also never got a croissant, so.
Annette, do you want to say yours? Because I don't know how to pronounce that word.
Yeah, it's a chalpino. It's a rich seafood soup with, you can put clams, mussels, fish, nice white fish, crab, shrimp in a nice tomato base, and you eat it with some crusty bread, sopping up all that goodness, and it's lovely.
Well, Robin's coming to your house. She put it in the chat.
Come on.
Better have it ready. She'll bring a pie.
Yes.
Cody enjoys the Polar Express. The movie, I assume, Cody?
Yes, the movie. And my sister and I also every year will try to make my mom cry while she watches it because she always cries at the song that they sing at the back of the train. And so we'll just be like, "Oh, it's so good to spend time with family," and then she cries. It's great.
Cruel of you. Sonia, tamales. Do you want to say anything about that?
No, just growing up with 8 kids and 2 parents, we had a whole assembly line going. So,
What was your stuffing?
well, masa, and then we'd make either red sauce or green sauce with different meats, beef, chicken, pork.
Just whatever. Okay. I didn't know if you had like one traditional, like we always do the beef tamales at Christmas. I love to go sledding at White River up on Mount Hood. It is not a place to go, and none of you should ever go there. Definitely, it's terrible and super not fun. And so please don't take my parking spot. Anyone else have a holiday tradition that they want to share with us?
I have one. Since I've been dating my partner, every Christmas Eve, We all go over to my kind of sort of parents' house. It's complicated. And we all get together and we watch a/1 or 2 Lord of the Rings movies. And then I get bullied for hours about how I don't like the Lord of the Rings movies, but I sit there anyway and I watch them because it makes everyone else happy.
They're very long to sit through if you are not a fan.
It's a walking simulator. Sorry, not sorry.
Is that what you don't like about them?
They're so long and there's so much extra lore. They'll be talking about all the different books there are. I'm like, books? Who do I look like, Stephen King? I didn't read no extra books. And they're just walking and talking half the time. And half the times like you could yeah, it just I love fantasy. I
You have to turn
also
your nerd
love
card back
action.
in, Zafir.
I'm a different type of nerd. I'm the teacher, you said we had homework type of nerd, okay?
All right. Well, I think that is actually the very last slide that we had. And then we have announcements. Christy, keep your slides on deck. We have a couple of boring announcements. Is there anything else folks want to reflect on or celebrate before we close out the don't forget we're humans and we don't just do work portion of the meeting? Okay. Then I wanted to, Kyle listens to David Sedaris reading the Santaland Diaries. I know some people put some fun stuff in the chat. I didn't see it all because I was doing this, but if you want to see what your peers do for Christmas or for whatever holiday they celebrate, check the chat. I thought this was really cool. I wanted to put this out there in front of folks. This Together We Plan, a community and tribal budget session opportunity to join either in person or online to participate in learning how the Oregon Human Service budget is built, explore the risks and choices that Department of Human Services is considering, understanding when and how you can put input into the budget process and share your priorities. So we have the links here for a Salem event and a Portland event in person or a January 6th event online. Very cool that DHS is trying to do this, and I think it'd be neat if any of us wanted to attend and try and learn from that. Maybe we can try and replicate a smaller version of that process for our budget build for the next time around. Jackie will be there. Awesome, Jackie. Maybe you can bring back some tips and pointers to the staff. Awesome. Thanks. I have pestered as many of you as I can. Council member annual training is required by the end of this year. There are 2 required trainings: prevention of discrimination and harassment and information security. You also have to do them in 2026. So if you do it on the 31st and then again on the 1st because you're bored, you've got both your boxes checked. I know a few of you are having a hard time getting into Workday. Feel free to actually text or call me. I will do my best to get you in there. And if we can't, I do have them printed out, but they're a few years old, so they're not as updated. I could email them to you and we can do an alternative way to make sure you get your credit. And then the coach approach, you will need to register. Immediately after this meeting, I will send you an email and everyone else who has already left an email with the registration link so that they can manage the Zoom and put us in breakout rooms and all of that. But for the next January 20th, February 3rd, February 17th, and March 3rd, instead of having our full council meeting, we're going into closed session for council training, where we will be doing culture building and skill set training on how to deeply listen to what each other is saying and solve problems together when things are difficult. We will be actually doing real problem solving with one another together, not role playing. And so it will be a closed session because some of those problems may include confidential information that would only be shared in a little dyad conversation rather than in a public meeting space. I did check with the Oregon Government Ethics Commission, and that is totally above board as long as we are not making council decisions in the space. So, really excited about this training. It was developed in partnership with family advocates. Joylene, I don't know if there's something you want to say about why we are partnering with the coach approach folks.
Well, I met these folks in DC. You all paid for me to go out there, and I brought some resources back to Oregon that I think are really going to be what we need to bring us all together, so we can just work a little more respectfully and efficiently together as a group, seeing each other as humans. So very excited about that. I hope to see all of you there. There's some really great folks. And I think one thing I will add is that they actually will have some people with lived experience helping co-facilitate the training, at least one mother, I believe, from the state of Washington. So look out for that information in your email. I am looking forward to it, is what I'll say. I hope you are too.
I'm really excited about it. And then we're not doing any subcommittee meetings during all of that time. So this is, if you're coming to exec tomorrow, that will be it for SOCAC subcommittees until 2026. Please let staff know your questions or concerns. We will be in regular touch with all of you, but our meetings will consist only of these coach approach trainings for the next few months while staff gets the work behind the scenes dialed. Oh, Joylene, would you like to say that out loud?
Sure. I also wanted to do a quick shout out to Corinna Hazard, the missing SOCAC staff member. She's not here today, but if you enjoyed this meeting and the time that was set aside for celebration and remembering each other, that was really her work that she championed. And so I want to uplift that. Yeah, and just give some credit to Corinna. Thank you.
Thanks so much, Joylene. That's important. And that is it. I usually have a next meetings slide, but apparently I don't. So I'm going to stop sharing. And Christy, do you want to turn on our song? And
I sure do. Been waiting months for this moment. Share sound. Okay, you let me know if it doesn't come through. I'm pushing play. Are you looking at my screen?
We're looking at your inbox.
Invoices.
I see your Outlook page.
Very exciting here.
This better be good.
I just want to do that. Oh, there we go. Okay. You hear it?
We hear it, but we're still seeing your Outlook.
I used to think 6 systems were pipes in the wall, but turns out it's people just trying to care for us all. From therapists, caseworkers, judges, and more. There's a whole team behind every closed door. They got goals, they got charts, and a thing called shared care that sounds pretty smart. It's in the plan. Equity, access, and not feeling banned from services that actually work as a team, like wraparound care and behavioral dreams. We got youth at the table and data in hand. Strategically caring. It's in the plan. What's in the plan? Oh, it's in the plan. It's in the plan. There's a roadmap, a toolkit, a webinar too. I clicked the wrong link and now I'm on a review. But I know that they're trying. They even took notes. And someone just emailed me 67 quotes. So bring on the partners, bring on the forms. We'll navigate systems through policy storms. It's in the plan. No silos allowed, we're in one big van. With counties and tribes and communities say. And 3 acronyms I still mix up a day. But I trust the process, yes I'm a fan. Strategically caring. Oh, it's in the plan. It's in the plan. It's in the plan. It's in the plan. We got youth voice, choice, and chocolate at meetings. And someone brings snacks now, that's strategic greeting. One zoom where my cat hit the main. Whoa, it's in the plane. Oregon's got a collaborative jam with culturally humble community flair and case managers who actually care. So let's break the silos, hold each other's hands. Strategically caring. It's in the plan. It's in the plan. It's in the plan. It's in the plan. And if it's not in the plan, we'll draft an addendum and probably review it quarterly.
Okay, sorry.
That
Louise,
was
your staff
great.
thought that was hilarious.
Thank you. Wasn't that fun? I'll send you the link so you can listen to it whenever you need a little, pick me up.
All right. That's all we
nice.
got, folks. Appreciate you.
All
Thank
right.
you all so much.
You're welcome.
Goodbye, y'all.
Happy holidays.
Bye-bye.
Happy New Year.
Happy
Catch
New
some of
Year.
y'all in the new year.
Bye.
See you
Thank you.
next
Happy New Year.
year.
Bye.